Your health is personal, so your healthcare should be too. That's what makes Fountain Valley Healthcare stand out. Jacqui Jordan, one of their trusted nurse practitioners, is here to tell us more about their team and their focus on relationship-based care. Good morning.
Good morning.
Okay, for our viewers who might not be familiar, let's kind of start about what makes Fountain Valley Healthcare different from other primary care facilities here in the area.
Yeah, so we're locally owned and operated. We started it 3 years ago now, almost 4, and I grew up in that area. So a lot of times down in that area, there's not a lot of things available. We have to go up north. So it was a good way to kind of, bring something that our community needs. And the difference with us is we're small. You see the same provider every time you come in, hopefully. Sometimes if it's an urgent thing, we'll get you in with whoever. But you have that continuity of care. We also offer some different services as well, like we're integrated with behavioral health. So we have psychiatric nurse practitioners that can do medication management as well as therapy on site. And then Spravato treatments, which is ketamine treatment for refractory depression. So if somebody's been on meds and they're not getting any better. We also do substance use treatment, and it's kind of a one-stop shop, so that's what makes it nice. We recently added some hormone therapies as well, because that's been a huge part of actually helping people be healthy. So we're pretty excited about that.
Who would you say would benefit most from your clinic's approach to healthcare?
So somebody who maybe is tired of feeling like they're just a number, you go to some of these different clinics around town, and it's, sorry, you only have 5 minutes and we can only talk about one problem. That's not our goal. We know you took a lot of time out of your day. You rearranged your schedule to be there, and we'll take the time that you need to sit and listen. And if we need to get other people involved because you thought it was a medical problem, but maybe it's more anxiety, and maybe addressing that will make things better for you. We have the ability to do that all in one place. You don't have to go to 4 different places for what you need.
All right, let's go and expand on that hormone replacement therapy that you talked about that you guys recently launched at the clinic.
Yeah, so one of the things we've learned, there was new research that came out in October, especially centered around women's health, which is great because we get forgot a lot.
Yeah, oh yeah.
And as we get older, hormones are a huge issue for us. Men too, but women especially, we've been kind of told, don't give women hormones, you're gonna kill everybody, they're all gonna die of breast cancer, like it was what we thought for 25 years, So we were really, as medical providers, we're like, we're not doing that. And now there's a lot of research that came back out from those 25 years saying we're actually doing a huge disservice to our patients. So we're seeing higher rates of breast cancer, osteoporosis, dementia, heart disease, strokes, all
serious
because
illnesses and diseases.
Yes, all because the hormone levels are never addressed. And it makes sense. We weren't made to live as long as we were, so we didn't know what that effect of not having those hormones in our body for that long did. And if we can make that one little change for people, and it not only improves their quality of life, but we're actually preventing a medical problem, that's amazing.
Who would you say is the best candidate for this therapy then?
So really women about age 35 start to lose some of their testosterone. So women 35 and older, we can look at like more testosterone replacement, and then some stuff to help with those perimenopause symptoms where you kind of feel like you're crazy. You got these roller coasters, these ups and downs. So helping with that, and then as you get older and start to go through menopause and you're having those night sweats and hot flashes and mood swings and you're irritable, you want to kill your husband kind of things, like those.
People understand.
Yes, helping with those relationship issues. Sometimes hormones are the way to go for that. So, kind of looking at that, and we evaluate your risk profile. We want to make sure that we're not causing any harm there.
So how does integrating services like HRT, mental health care, and primary care actually benefit your patients?
So the one thing I hear from people, feedback from my patients is like, wow, I've been to so many places and people don't listen, or you're not looking at the whole picture, right? That's the big difference, is somebody that is just has no clue about hormones, right? They're gonna look at your labs and go, oh, it's fine. You're fine. And you're like, but I don't feel fine. Or we'll look at something and go, well, your chest pain, it's not your heart, you're good. But really it's anxiety, and nobody's helping you address what that underlying cause may be. So that's the nice part about us. And if you want to come just for mental health, that's great too. You have a primary care you love, that's great. But we can help you with some therapy services. We can help you with medications. It's kind of a whole person approach. We're not just going, you're good.
Yeah. Well, Jacqui, thank you so much. We're not quite done with her just yet. We're going to learn a little bit more about Fountain Valley Healthcare and how they've been able to kind of include the community a little bit more in what they're able to do and who they are able to help. So stick around. We'll be right back. Sound good?
Sounds good.
Get online or call to see if Fountain Valley Healthcare can assist you with your medical needs or your mental health needs. We'd also like to thank them for bringing us this segment.